as you're getting ready for graduation, how many of you have decided where you're going to work when you graduate? Does anybody have any prospective offers as we get closer? No, not yet. Okay, I have another question. How many has, how many when you started in nursing school had an idea that you wanted to work in one area and have changed your mind since you started nursing school? Anybody? Yeah, Kaya, where did you want to start?
I really didn't care, honestly, at first. But now I'm kind of leaning towards like peds.
Okay, I love peds. Peds is awesome. And I know a lot of students, it's interesting when you listen to students, when I would talk to students at the beginning of their programs, and they'd be like, oh yeah, I want to do, this when I graduate. And then as they get towards the end, they've decided that they like different areas. And it's basically just because of their exposure in clinicals, right? You learn a lot when you're in clinical and you get to kind of see a little bit of everything while you're in school, and sometimes you find that right fit. So I will share my screen. All right, can everybody see the PowerPoints? Thumbs up. Awesome. Thank you, Naya. All right. So finding the right fit. So there's a lot of places that LPNs can work or LVNs can work. Um, Long-term care, assisted living, independent living, schools, home health nursing, mental health, military service, hospital nurses. Anybody thought about joining the military? There, one, okay, awesome. It's Casey? Awesome. What branch?
Oh, I don't know yet. I was just thinking about it. It's not something fixed.
Okay. Awesome. So there's, and then of course, hospital nursing. Now we know that hospitals have opened up for LPNs to, work in the hospitals again. I remember back when I was a brand new LPN, um, they had just started phasing the LPNs out of the hospitals. And now you see that we're phasing them back in. One of the biggest growing areas right now is long-term care. Um, and so, that's because of the wonderful aging of the baby boomers, right? And they're going to need care. So transitional care once they leave the hospital, whether it's in a long-term care facility or even home health. They may not be able to take care for themselves. So that's going to be a huge hit. And there's, a ton of opportunities for LPNs in long-term care facilities. Um, Charge nurses. I've even seen LPNs as assistant directors. There's MDS nurses, which are the ones that are responsible for maintaining the state reports. So there's a lot of opportunities. Assisted livings in some state, I've seen LPNs actually run assisted living facilities. So that's something that, if you're interested in as well. Schools, the peds nurses out there, working as a school nurse. It's a lot of work, but it's very rewarding, working with the kids. So there's a lot. Mental health, we also know, is a huge need in our communities. Um, there's, huge mental health crisis, not enough mental health providers, whether it's nurse practitioners or even providers and nurses. So that's something that is also, going to be opening up those positions as they, develop more and more facilities. Those positions are going to break open as well. So when we look at, other things too, we have doctor's offices, outpatient clinicals, urgent care centers, chiropractic offices, veterans health, veterans administration. There's lots of veterans out there that utilize the veterans hospitals. So USA Jobs is a good place to look for that. Anybody think interested in hospice? I don't see any hands. Oh, I do. Okay, Audrey, you like hospice? Awesome.
Yeah.
Takes, and that's another area. I've worked with a lot of great hospice nurses. Um, it is a very, I don't know how to explain it. Hospice nurses are amazing people and they do wonderful things. Um, Then there's, the private duty nursing, health or insurance companies. They have like LPNs can work as health coaches, um, with insurance companies or even sometimes within doctors' practices, just assisting them with, education about their medications, and some of their other needs. So that's something that we can, that you have available to you as well. Charisse, what were you saying?
Huh?
You were talking. I didn't know.
Well, sorry, didn't know I was off
Nope.
mute.
No worries. Okay. Um, what else? Coroner's office. I always thought that would be really cool, but I don't know if I could do working in a coroner's office. But it definitely would be something interesting. Pharmaceutical sales, there's parish nursing. You can also join an agency and do temporary positions. Or of course, there's travel nursing too. So if you want to travel, whether it's within your state in your area, or even within other states. So there's lots of opportunities for practical nurses as you get out into the field. So some of the helpful personal attributes, I can't even say the word, um, be caring, have an empathetic nature, remember, not sympathetic, have a genuine concern for the welfare of your clients, emotional stability in stressful situations. We deal with patients at their best and at their worst, right? So, you're going to be working with sick and injured clients, that can be stressful, right? So being able to, hold it together in those stressful situations. Um, you have to have good observational skills, critical thinking, decision-making skills. You need to be able to communicate with your clients, at a client's level, right? So they can understand basic comfort in or basic comfort level and skills within the scope of your practice, right? So these are depending on where you're working, you're going to enhance your skills, right? So practicing them as much as possible, whether it's in your skills lab or in your clinical or your preceptorship, trying to make sure that you're honing in on those skills. You need to also be able to follow, physician's orders under the supervision of a registered nurse. Be assertive, right? There is a difference, right, between assertiveness and aggressiveness. Again, that client advocacy is super, super important. Again, we see patients at their worst, we see patients at their best. Making sure that we're advocating for the best things for our clients, maintaining confidentiality, right? Those HIPAA laws. You're going to hear a lot of things, you're going to see a lot of things, right, that can't be discussed with others, outside of the healthcare team. So you have to make sure that you are maintaining confidentiality. And then one of the biggest things as a future nurse is finding a healthy way to relieve stress at the end of the shift, right? So what are some healthy stress management techniques that you practice? Anybody have any good ones? Anybody have any? What do you do?
Exercise.
Exercise. Okay. What else? Anybody else have any other good ones? The gym. Okay.
Yoga.
Yoga. All right.
A glass of wine.
A good no, that is not a healthy one.
Music.
Music, okay. Now, a glass of wine is not bad every once in a while. I'm not saying that. We just have to be careful, right? Um, again, nursing is stressful, nursing school is stressful, right? So it's, trying to find ways to help relieve stress is always good. We kind of are going to have the weight of the world on our shoulders, right? Because not only do we have to deal with our own personal issues and our own personal lives, right? We are also going to be dealing with our patients and their issues and the stories and things that they have to tell us. So finding a way to relieve stress is going to be super important for you and to help you to maintain, a good, happy mental health as well. So qualities for nurses working in home health. So home health is another, great place for a job opportunity. I have seen lots of postings for home health, and it's not always with your older clients either. It's your pediatrics has lot home health needs. You have, middle-aged adults and younger adults as well that have chronic health needs that require home health. So being flexible, right? You'll have to improvise in home health as well, but still practicing good sound judgment, right? Client assignment needs or changes. You also will have to travel, right, from one client's home to the next. Must have really good communication skills. So you have to be able, not only you have to be able to understand the client's expression of needs, but you also have to be able to express yourself clearly. And self-confidence, right? Um, Patients can pick up on whether you feel insecure or uncertain. And doesn't matter if you're an LVN or LPN or an RN, they know when you're uncertain of something. And so it doesn't mean that you need to fake being confident, right? But you also don't want to ask for reassurance when you're performing skills. If you know, and this is something I've always said when I've worked with, nurses, you never tell somebody this is your first time doing it or your second time doing it, right? Um, that doesn't build confidence, right, in your skills. You want to do everything to the best of your ability. If you don't know how to perform a skill, right, we don't do the skill, right? You go and you ask for assistance from a supervisor or somebody else before performing that skill. Just because, you don't want to cause any harm. You also must be sensitive to physical and emotional changes. So obviously in home health, the RN is going to be the one to do the initial intake visit. They'll do the initial assessment. And then you as the LPN going in are going to be responsible for noting any changes in their status, and then alerting the RN to those changes. And so that RN is depending on you, right? And your observational skills, and communicating that back to them. Also have to have the ability to deal with emergencies, right? Making sure that you stay calm, and that you're still following your agency's protocol, right? So this is where, again, your basic nursing skills, your observation, your assessment skills are going to be very important. And one of the biggest things too that we need to have is a non-judgmental attitude. You're working in a client's home, you're providing the service. If you're comfortable with your own values, different values shouldn't be threatening to you. You also have to be aware of, any biases that you may have, and avoid stereotyping clients, right? Whether it's, where they live, how they maintain their homes. In certain cases, you may have to address certain safety issues within that home. So interpersonal styles. We look at interpersonal styles. We have the analytical type, we have the driver type, the amiable type, and the expressive type. So different types of styles that we have when we are communicating. So the analytical type is very detail oriented. They can make difficult decisions with all the facts. They're perceptive. They also may tend to be a little bit more pessimistic. All right. The driver type tends to be more blunt, is very objective focused, is a hard worker, makes quick decisions, is independent. It's, a can-do person. They tend to be assertive, distrusting, impatient, high energy. And so the driver type is, what is something you enjoy about nursing, right? So you've come a long way in your nursing practice. What is just you, whether it's one word or a few words, what do you like about nursing? What do you enjoy about nursing? That's a rough question, right? What do you guys like about nursing?
I get to help people
You get to help people. Okay.
and
You
I
get
get to bring enjoyment to them,
Okay.
especially the elderly.
Okay. The act of caring.
you
Okay.
get to meet people from different walks of life. Like you never know who you run into.
Right. You get to meet all sorts of people. And that's a good one too. Anybody else have anything?
It's a long lasting career. Like, you'll always have a job. Pretty much.
Okay. And that's very important, right? To be able to take care of yourself and your family is awesome.
For me, I just like to watch the progress. Like working in a nursing home as a CNA, you get to watch a bunch of people rehabilitate and go from like the bottom of the barrel, like they're in their worst spot, period. I don't even care about the thank you. I don't care about I obviously I want them to do better, but like I want them I like to see the progression. I like to see how far they've come so that way there's someone there that does remind them like, hey, look at what you did and you thought you could like,
That's a really good point. Yep. Okay, awesome. Yeah, I personally I love long-term care. I love pediatrics. Those are my two favorites. So yes, working, with patients and even not with, long-term care, even working in the hospitals, you see somebody that comes in with a trauma, right? Or a major, has major surgery and you get to watch them recover and get better, on a daily basis. So absolutely, that's awesome. The amiable type, they tend to like to be liked, right? They want to be liked. They're easygoing. They're not going to take a lot of risks. They like to blend in. They're highly sensitive. They have difficulty making firm decisions. They tend to be more quiet and soft-spoken. So when we work with those types of people, we're going to start off with, more kind of, small talk. And then the expressive type, they're the used car salesman, right? They're the natural salesperson, the storyteller. They're good motivators. They tend to exaggerate, leave out facts and details. They're more relationship oriented, right? So these are some of the interpersonal styles that you may see. Can anybody see themselves falling into one of those styles?
analytic and driver.
Analytic and driver. Okay. All right.
Analytic and amiable.
Okay. Analytic and amiable. Okay. So there's going to be different combinations, right? You just like you guys say, you can see yourself falling into a couple of those ways, right? So,
I think I could do all four. It just depends on a patient I'm dealing with.
okay, good. So flexibility, right? Being able to adjust, right, your interpersonal style based off of who you are responding to. Awesome. Very cool. Good job. All right. So again, as we're getting ready to find those jobs, right? Potential references. So potential references, think about, people that have seen you work, and that may be willing to either confirm in either writing or verbally that you are someone employers should hire, right? Whether it's um, an instructor that has watched you grow throughout the program, whether it's a prior manager, someone that you worked with previously, supervisors. For those of you that are CNAs, right? I'm sure that you've had, RNs or LPNs that you've worked with, or other leaders within your employment agency, right? That you may be able to ask for references. You also can reach out about potential job openings. I will tell you one thing, and this is just coming from someone who's been in education for a while. Always ask permission from that person prior to using them as a reference, right? So if you're going to use an instructor, you're going to use an employer, a specific nurse, you always want to ask if you can use them. You also want to ask if it's going to be a positive reference. Never assume that you're going to get a positive reference. All right. So always make sure that when you ask, can I use you as a positive reference? And then, get their information. So you want to get their name, their job title, their address, their telephone number, email address, right? Again, make sure you ask. And you can always too take the initiative to ask for letters of recommendation. Again, whether it's from a former manager, whether it's an instructor, another nurse that you worked with, make sure that, you can, like I said, you can ask them, hey, can you write me a letter of reference? And that also too, if they write you a letter of reference and they hand it to you, then you have the ability to either use it or not use it, depending on, right, what was written in that letter. So job hunting and networking. So everybody's heard of networking before, right? And I'm sure in some cases, you've heard this from either your clinical instructors, your deans, or other instructors, that when you're out there and you're doing your clinicals, right, that's almost like a job interview, right? Those nurses, those managers, and those people in the hospitals, they're watching you and seeing what you're doing. So, that's, something you can network through some of the people that you're working with in your clinicals, family and friends. Do you have friends that are already working in healthcare or family members that are working in healthcare, right? That may be somewhere, that you can network as well, offer, to try to find a position that, you're interested in. Um, Placement personnel. There's, career or like job workforce centers. There's at Fortis College, right? You have career services as well, that may help you to find positions. They, a lot of times too, they offer like free resume workshops. even like mock interviews. Has anybody done a mock interview yet? No?
No, not yet.
Okay. So mock interviews, especially for those who, some students are, right out of high school and, maybe have not had a job, have not had the experience of job interviews, right? So working with career services, that will be very helpful to you. And then, of course, there's things like LinkedIn, there's Indeed. Those are some of the social media websites. LinkedIn is a professional social media that can help you to find mentors, find hiring managers, as well as, recruiters. Link or Indeed, Indeed is another one that lists positions that you can search within your areas to try to find positions. Biggest thing when you're using those professional or those social media sites, don't add your current employer or supervisor to your network. Be very selective about adding coworkers as well. You don't want to post any opinions about your employers. Um, you don't want anyone else posting on your walls. You don't also want to announce your intention to leave your current employer. Most of our states are at will and, at will employment. So if you post on there that you're looking to leave your job, you might find yourself without a job, right? Prior to finding a new one. So be very careful with that. So, those are just some little tips, right, to kind of help you look for that job that you are looking for. When you're networking, you always want to maintain a positive attitude with everyone you meet. Again, job bashing is not usually a good idea. You always want to try to find whatever positives there are with your current positions. Seek input of your supervisors and other experienced nurses on how to build your career. Ask someone to be your mentor, right? If there's someone that you really respect that you've worked with, then ask them to mentor you. You want to build relationships with key people where you work, right? So your supervisors, your managers, your DONs, be willing to lend a hand without being asked and mentor others. And I know this is hard. Nursing is hard. And there's a fine line, right, of doing too much. But if you're working and there's another nurse that's struggling, right, and you have the available time, right, you want to try to assist others. Don't ask, just kind of help. Nurses, we can't do it alone, right? It requires teamwork. And so we all need to work together in order to provide the best care for our clients. Ask about facility committees you may want to participate in. Depending on where you work, there's a variety of committees that may be available to you. Like for one in long-term cares, quality improvement is always a big one. And look at improving the quality of the care that we're providing to our clients. How to prevent falls is always a big one in long-term care, right? How do we keep them safe? What are some things that we can do? And then join professional and community organizations. And so that does, cost some money in order to join some of those professional organizations. But those are also things that you can potentially look at. All right. So when we look at the resumes and the application process, all right. So resumes, there's a variety of different ways that you can write your resumes. Everybody, there's different types of resume formatting out there that you can use. Just when you look at, making your resume, you should try to make it as short as possible. Always, one page, 2 page, it should be 2 page maximum. 1 page is generally enough. You want to tailor your resume to the job that you want, right? So, you may have, I guess, a resume that you've written, and, anytime you send it out for, a specific job, you want to tailor that header, right? Your summary of your qualifications or your introduction at the top of the page, tailor it to what you want with the job. There are some cover letter examples in your book as well. And then when we look at answering the application questions, I cannot stress the importance of this. Do not falsify any of those answers. I've had, people that, I'm sorry. I've had people that, have said that, they don't have, any convictions or, any issues with their backgrounds. And of course, when you get the results back from their background checks, there's inaccurate information. So always be upfront and honest when you are filling out those application questions. So again, basic resume factors, 2 page maximum. 1 page is always better. Only utilize, the experience that is necessary to get that position. Quality bond, white or off-white, no designs or textures. Everybody's seen some, I don't know how many of you seen some resumes, but those big resumes with the nice headshot on there, you don't need to do all that. Try to keep it as professional as possible. Use proper font. Always use spell check. Spell check is absolute necessity. I also recommend having somebody proofread your resume for you to make sure that grammar is appropriate as well. And then, type it and save it, because you can also, send your resume electronically in some cases. For example, too, if you want, and I think Indeed does as well, or I'm sorry, I think LinkedIn does as well, but I know Indeed, you can actually build your resume Indeed so that as you're applying for positions, right, it automatically saves your resume, and will submit that for you in some of those like quick applies. Otherwise, you may have a job listing and may have to go to an external site to apply for that position, right? But having your resume electronically is also a good way to keep it. Avoid faxing your resume unless it's specifically requested. Make sure you have nice balanced space. And the goal here too is emphasize your strengths. What are you really good at? And that will help, right? That's going to stand out to somebody that is reading your resume. So just take that into consideration. Like I said, Fortis does have career services that can help you to write your resume if you don't have a resume, or even if you do have a resume that needs to have a little bit work done on it. Go ahead and make sure that you're reaching out to them for assistance. So going for that wonderful interview. All right. And we're looking at, how many of you have been on an interview? So a few of you have been on an interview. All right. So there's questions that they are allowed to ask, and then there's questions that they are not allowed to ask. Okay. And so, you have to be, they may, trick you into it. So, if they ask, what would you say if somebody asked you if you'd been hospitalized within the last 5 years? What would be a good response for that? Because hospitalized
It's
can be
personal.
anything. Okay.
I wouldn't want to disclose that information.
Okay. Or, something simple like, I don't have any health problems that are going to interfere with me performing this job, right? Because your hospitalization, maybe you gave birth, right? And you had a child, and, there's no long lasting, issues with that. Or, you know, there's a variety of reasons why people will be hospitals. They're not allowed to ask you. So just all you have to do is say that you don't have any health problems that are going to interfere with you performing your job duties. Have you ever been on workers' compensation? Okay. You can say either no, you've not, or you can again say, I'm able to perform all of the described duties. Do you have a criminal record? This is where I was saying, be very honest and factual. Okay. Whether, and speeding tickets will show up on a background check depending on, how long ago that speeding ticket was. So, tell them you received that speeding ticket, but you've never had any misdemeanors or any felonies, or even if you have had a misdemeanor or a felony, you can just say that, what you have done to overcome, right? Um, have you taken classes? Have you played retribution? Right? You know better now. You're not going to let that, behavior repeat itself, that kind of thing. So preparing for the interview. So those of you that have been in an interview, what are some questions that they asked you?
Tell me about
Tell me
yourself.
about yourself.
And how many hate that question? Yep, that's probably the worst, right? That is probably the worst. Be kind of prepared for anything. When you're preparing for an interview. So you aren't the one, you're being interviewed, yes, but you're also interviewing, right, them as well. Because you're gonna get the, you'll get that feel, do I really want to work with, do I really want to work here? What is my expectations? How does it feel, right? First impressions, right? They're going to ask you a bunch of different questions, right? Of course, the tell me about yourself. I'm with you. I don't like that question. You can ask them though, do you want to know about me personally, or do you want to know about my work history? Right? Work history sometimes is a little bit easier to discuss, right? You can, tell them about what you have done previously, even if it's not in healthcare. Healthcare is very customer service based. All right. So use, any customer service experience that you have had in the past. Talk about your school, right? What your experience was involving clinicals. If it's personal, you can just keep it very, simple. Another question is, have you ever done this type of work before? So even as new nurses, right? Technically, you have done this work before, right? During your clinical experiences. Or even if you know, were a CNA, you can hone in on those skills that you have had. Another one is, why do you want to work here? And this is a big one for a lot of people. When you are getting ready to go for an interview in an organization, do research on that organization, learn about the company. You know, I'm not saying, you know, do like a research paper on the organization, but definitely know something about the organization that you were applying for, right? Um, you know, maybe it's the mission statement, maybe it's, you know, their, location and their reputation within the community, and that's why you want to go work there, right? So hone in and have a good answer to that question. They also may ask you about your motivation. Another one too, they may ask you is, why'd you leave your last position? Why are you leaving your last position? So for some of you, it's a good way to say, you know, I'm just a recent grad and I'm looking for a new job. So I haven't really, you know, had any prior experience. Um, Again, you don't want any negative, right? You don't want to put anything negative about your current employer. Just say that you're looking for a new growth opportunity, something along those lines. You know, when they ask you about your employers, you always try to be positive. Um, and so there's a variety of other questions, you know, why do you think you're the best person for this job is another question they like to ask. You know, and this is where you kind of sell yourself, right? You know, I have really good analytical skills. I'm hardworking, I'm dependable, I get along well with others, right? I'm flexible, I'm adaptable. Those are some really good answers to that question. And then your strengths and your weaknesses. These are also, you know, right up there to me with the tell me about yourself question. You know, what are your strengths and weaknesses? You know, this is also like when you get those reference letters from people that you ask for reference, they also tend to outline your strengths, right? So you can look at those to help you identify some of your strengths, and maybe you might, you know, they might have identified a strength in you that you didn't know that you had, right? So you build on that. And then what is your greatest weaknesses? So that again, it's always hard to talk about our weaknesses and our strengths, right? But these are some things that you can think about now as you're getting prepared, right? So that you can be ready for those questions. Long-term goals is something that employers also tend to ask what's like your 5-year plan, right? So as you know, new grads, you know, are you do plan on going back to get your RN, your BSN, your MSN, your doctorate, your nurse practitioner, right? What is your goal? You know, and how does that going to, you know, fit in with that organization? So just kind of like looking at those things, trying to think of what else. That have been asked. But just, you know, kind of like look at some of those questions and be prepared. And that's why I said some of those mock interviews actually may be, you know, very helpful to some of you, especially if there's not been, you know, if you've not had a lot of experience with interviews. Another thing too is one thing is when they ask you, do you have any questions for them? never say no. Unless, I find it hard to believe in an interview that they are going to answer all of your potential questions that you may have running through your head. Always try to find something to ask because that just shows that you are interested, right? So, whether you're asked about the type of clients you're going to work with, the schedule, the shifts, how many beds are in the facility or on the unit. Is it 8-hour shifts? Is it 12-hour shifts? Another big one is, are you going to be floated to other units? Okay, that's another question to ask. What's the flotation? What's the float rotation? I worked with a company that had 7 long-term care facilities. And so if there was a need in another facility, they would ask for nurses to go to that different facility. All right. And they kept a flotation schedule. Okay. So that's something that you would want to ask as well. What type of electronic medical records do they use? So what charting system? Is it Epic? Is it Vision? Is it My Unity? Is it Point Click Care? Whatever one of those wonderful EMR systems. How long is orientation? All right. So orientation generally in a hospital is going to be a lot longer than in a long-term care facility, right? So you want to know how long orientation will be. Will you have a preceptor assigned to you? So what kind of mentoring process is there? And so, if, and then it's okay to ask, is this a new position or am I replacing somebody? And so if if it's an existing position and you're replacing somebody, why did they leave? It's okay to ask why a person left. So there's a lot of different questions that you can ask to show that you are interested in the position. So that is something that, again, just write a whole bunch of questions down. Some interviewers are really good about providing as much information in the interview process as well, and others are not. Okay, so just have those questions ready. And then making a last impression. And so remember, first impressions, right? Initial impression is made within the first 30 seconds. All right. So you want to make sure that you arrive and you make that really good impression. Good hygiene. And I know that sounds kind of crazy, right? But make sure you showered, right? Your hair is arranged in a moderate style. Your clothing is appropriate. If you don't know how to dress for an interview, again, use your career services. They're really good for that. Even as a nurse, in some cases, showing up in scrubs as an interview in some cases may be appropriate, in others it may not. So I always recommend professional dress. Make sure your clothing fits appropriately. It's not too tight. It's not too short. You don't have a lot of cleavage showing. Moderate amount of makeup. Same thing with your jewelry, right? Just be, very cognizant of your appearance, your posture, your manners. Also, for guys, right? Make sure your hair, your mustaches, your beards are neatly trimmed. Don't say I'm not saying you have to be clean shaven, right? Just make sure that you look neat and presentable. Think about nursing. I know this is crazy, right? But nails, short, clean, nicely manicured, clear nail polish is okay. But remember, most facilities are going to have some sort of regulations about those artificial nails. Okay. So try to keep, try to look nice and, professional. Same thing with eyelashes, the false eyelashes. facial piercings, right? You want to try to be a little bit more conservative. Don't smoke prior to going into your interview. Make sure that you're, not have a whole lot of perfume on. Make sure that you've brushed your teeth, right? Don't eat a nice big old onion bagel, right, prior to going into the interview. And again, you don't want to go in smelling like you have been smoking. You want to leave a nice impression. Let's see what else. And then after the, the pre-employment, physical, drug screening, background checks. Don't be surprised if you're required to do you have to meet with a employer specified healthcare provider. They will do an exam. They will legally ask you about your past medical history. So your surgeries, if you've ever been on workers' comp, allergies, all of those wonderful things. Drug screening, okay. If you're taking any medications, always make sure that you let them know. And then you either get a doctor's note from the person that prescribed the medication, or bring your prescription with you so that they can see it. Background checks. This is where I told you, right? Make sure that you don't lie on the background check. You provide as much, and be just disclose everything. It's just easier. And then after the interview, follow up. Follow up after the interview is essential. A lot of people that interview never even follow up to see if they got the job. So, right, that's kind of crazy. Write a thank you letter. It can be a handwritten that you can drop in the mail, or it can be an email. And you want to send that email or that letter the same day of the interview, right? So you want to make sure just so that it's fresh in your head. It also helps them to remember you. I know that sounds crazy, right? But the more that they see or hear your name, the better the chances of you getting hired are. All right. So it doesn't have to be a long letter, right? It can just thank you for meeting with me today. After our conversation about the job duties, whatever, right? I am, really interested in working on the unit, whatever. I remain interested, again, just kind of get your name in their head. And you can also follow up with a phone call, depending that, hi, or just, calling to either speak with the person that performed the interview, or if they, you can't speak to that, kind of just follow up and see, is the position still available? That kind of thing. So just keep that in mind when you're interviewing. You always want to do that follow-up. And then the last part is resignation with style. Most places it is customary to give at least 2 weeks notice, whether or not there's policy in place. And depending on what your current position is, some will actually require more like a 30 days. So make sure that you know what your current policy is regarding resignation. And that 2 weeks, right? Not only it, gives them time to try to find somebody new to fill your position, get them oriented. Even if you're not happy there was just not a good fit for you, this is not where you write that. Okay. You always want to just be very, I don't know, trying to be positive is what I can say. Please accept my resignation as a CNA, as a charge nurse, as a unit manager, whatever it is, and give the effective date. Again, usually 2 weeks. And, just say, you can really say, thank you for the opportunity. I've learned a lot while working in this organization, right? That kind of thing. So again, always try to leave on a good note. It's just because I know, there's a lot of hospitals, there's a lot of nursing homes, there's a lot of clinics, as many nurses are out there, right? But it is still a small world when it comes to nursing. The NCSBN transition to practice, so the National Council of State Boards of Nursing transition to practice model. This was made in an effort to help new nursing grads, whether it's RN or LPN, to transition into the work environment from education, right? The goal is to increase retention in their employment, improve client outcomes. So the main parts of the model were trained nurse or preceptor to assist the new grad apply theory to practice, develop their clinical reasoning, improve safety, as well as decrease practice areas in the care of clients. And so there's 5 online modules of study: communication and teamwork, client-centered care, evidence-based practice, and quality improvement in informatics. So a lot of different places have started to implement some sort of transitional practice when you get hired, more so in your hospitals than anywhere else. Sorry. When we look at professional organizations, so the NLN, which is the National League of Nursing, is open to all levels of nurses. So you have the opportunity, you can join the NLN. The American Nurses Association is only open for RNs. You have NAPNEs, which I know you've heard of NAPNEs before. You can join as an LPN, RN, or even a student. And then the NALPN, which is the policy-making body for LPNs, that's another one that you can join. And then we have continuing education. So to renew your nursing license, your initial nursing license, our nursing licenses are good for 2 years. Okay, so you pass your NCLEX, you get your nursing license, and they're generally good for 2 years. As part of your licensure requirement for renewal, you have to complete continuing education classes every year in order to renew your license. And if you join the ANA or you join NAPNES, there may be continuing education units that are available through those organizations, or you may have to look at some other CE sites. Depending on what state you are practicing in is going to determine the number of hours that you must complete. In-service training is something that's completely different. This is basically your employer requirements, okay? Most places for yearly requirements like bloodborne pathogens, your HIPAA, your fire safety, trying to think. There's a whole lot. Trauma-informed care. So there's a variety. And those are required by your employer. They usually don't have any CE credits available. However, it depends on where you work. Some of them may have some CEs. Workshops are also in some areas are available. There's also things like podcasts. Medscape is another really good one that gives information about healthcare changes, new guidelines for care, emerging infections, disasters, that kind of thing. There's a variety of other journals that are out there that you can use. And there's free CEUs that are available to you as well. But again, you want to check your state and to see what the CE requirements are, so that you make sure that you get them done yearly. We look at certifications. So NAPNES offers two, is it two? No, it's three, sorry. They offer the long-term care certification, pharmacology certification, and IV certification. So you can go to napnes.org and see what what the certification requirements are. There's also the ABCM, the American Board, is it ABCM or ABMCN, sorry, the American Board of Managed Care Nursing Certification in Managed Care. That is also now available to LPNs. I have my CMCN, which is what it is, the Certification in Managed Care Nursing. I did it when I was working I worked for an insurance company for a while that we needed to get certified. Certification is valid for 3 years. All PNs can get that certification now. So it's just basic knowledge about managed care, healthcare economics, healthcare management, client issues, that kind of thing. One thing though, I will be just to remind you and let you know, when you get certification. So we talked about CEUs that are required for your nice licensure renewal. If you get a certification, there's additional education that you may have to get. All right. So you may have, in order to renew your certification, you may have to do some like, I don't know how many hours. I can't even remember how many hours I need to do for my renewal, but they may require another amount of hours to renew your certification. So always keep that in mind too, and that you pay attention to that as well. And then of course your registered nurse career pathway. There's, in some cases, right, as a LP and LVN, they're, find jobs that are a little bit more limiting. And as you get experience and you continue to grow and practice, you might decide that, hey, I want to do more. Okay. Salary differences is also pretty significant between LVN, LPN, and RN as well. And you may look to try to move on. So, even sometimes too, when you're looking at, current employers, if you already know that you want to go on and get your RN, look to see if they have any type of tuition assistance, right? Are they going to help you pay to get your RN? And so that is something that you can look for if you already kind of know, like, hey, I want to go get my RN eventually, there usually are some requirements that you work with the organization for a period of time, depending on how much they give you in tuition assistance. Okay, but that is something that you can also look into when you're applying for those positions. All right, so any questions? No? All right, let's go ahead and take a break. Be back at 4:25. All right. So our next topic is going to be nursing theory. So I'll share my screen. All right, so nursing theory. So there's numerous nursing theories that have been developed for nursing. Some of them are actually the basis for curriculum development. So when nursing schools are developing their nursing curriculum, often they have a theory that is the basis of their curriculum. They also provide a basis for research on the effectiveness of nursing care. And so three concepts that are really important to nursing is obviously the person, right? The person that we are caring for, health, which is the goal of nursing, and the environment. So that is the setting where nursing care takes place, right? So whether it's in a hospital, in a long-term care facility, right? A clinic, a doctor's office, wherever. So why do we have to talk about nursing theories? So you should understand the basic foundation of why we do the things that we do, right? And then if you decide to become an RN and move on, you'll learn about these theories even more because they are the basic framework for education as well as clinical practice. And depending on where you work, you may work with nurses or other research staff, and you may, be asked to gather data. So it's just really important to have kind of a basic understanding. So everybody should know who Florence is. Florence Nightingale. She was our first nursing theorist. She was the first to emphasize the environment, ventilation, warmth, noise, light, cleanliness, especially. She is considered the first nursing theorist again. She believed that environmental issues influence the course of illness. She also, saw the nursing role as separate from the nurse to the healthcare provider. So she also was the first person to, collect data, use evidence to make clinical decisions. She determined that if the environment was warm, clean, lit, minimal noise, right, that resulted in decreased death rates for soldiers. So, that's kind of what she taught her nurses to practice with. One thing that I found really interesting when I was in school, when I was doing research for something, did you know hospitals used to operate, and this was a long time ago, but they used to operate on a 9 to 5 basis? So nurses went in the morning and they went home at the end of their shift, and the clients were left there by themselves. The patients were left by themselves overnight. And so, obviously there was a lot of significant issues arose from that regarding cleanliness and, deaths that occurred. And so they, eventually realized that they needed to staff those hospitals 24/7. I just thought that, I don't remember, I want to say it was in England. But I do remember reading about that during my time in school. And I just thought that was like, wow, could you imagine hospitals, nursing staff is only there for, 9 to 5, and you kind of on your own for the rest of the day or the rest of the night. So obviously we've come a long way in healthcare. Another, the human needs theory that was developed by Abraham Maslow. He was a psychologist, okay, rather than a nurse. But it's a framework for education that we use. So his theory states that certain internal, external, physical, as well as psychological needs are common to all people. And so those human needs are arranged in a hierarchy. And again, you should have heard Abraham Maslow before. Any unmet needs create tension, which motivates the person to react to meet those needs. And then when their needs are met, the person is no longer aware of the need because it's met. And so that, that no longer motivates them. The dominant needs that matter to a person can vary in life. All right. So, really just kind of depends. And so if you remember the hierarchy of needs, right? So we have the basic needs are at the bottom, right? Your oxygenation, your nutrition, elimination, safety, rest and comfort, hygiene, activities. Those are your basic. And then above that, you have your security and your belonging, right? So security is your psychological comfort, your assistance in meeting needs, your comfortable environment. Belonging is your social interaction, your communication, your human caring, your family. And then we, as we go up, we go into self-esteem and love, right? So love is, giving and receiving love, affection, intimacy, your sexual expression. Self-esteem is your independence, your competence, your motivation, learning, spiritual beliefs. And then your sexual self-actualization is at the top. That's your self-knowledge, your acceptance, achievements, your universal knowledge, right? So those are all at the top. And so when we look at, when we are, developing our plan of cares and we're working with our clients, right? We have to understand that those basic needs, oxygen, food, water, elimination, safety, sleep, activity, right? Mental stimulation are all those basic needs that we must meet. And once those physiological needs are met, then we can move on to the safety and security needs, right? Like how do they get to the, from the bed to the toilet? And it's both, real or imagined safety needs, right? So when we look at, again, providing safe, effective care, right, we have to move through those, starting with the basic needs and then moving up. So a couple other theorists out there. So we have Orem. Dorothea Orem developed her self-care deficit theory, which consists of 3 sub-theories. We have self-care. This involves a goal that is directed towards a safer environment for life, health, and well-being. So basically, part of that is the person learns to respond to health cues in themselves or the environment as a way to maintain personal health. The self-care deficit is personal care does not meet the therapeutic self-care demands. So they may not recognize or know what to do in regard to personal health situations. And the nursing system. The nurse empowers the client through their interpersonal relationships to meet their self-care demands, right? So we respond to them holistically, right? So we respond to all of their needs to assist them. And so the theory is concerned with growth and development needs, as well as the physiologic and the psychologic needs. So we can use the data collection step to identify specific self-care deficits that our clients may have. We have Madeline Leninger. So Leninger's interest in cultural, Madeline's or Leninger's interest in cultural care and how nursing responds to persons of different cultures, right, began when she was working with kids that had special needs. And so this is where she developed her cultural care theory. There's 2 types of care in every culture. We have the generic and we have professional care. So generic is, the home remedies that are used in care. And then professional is, that's provided by people who are specifically trained to provide care. And under that, she proposed 3 modes to guide nursing decisions when providing care. So your 3 modes are your cultural care preservation or maintenance, your cultural care accommodation or negotiation, and cultural care repatterning or restructuring. So cultural care preservation or maintenance, right? So this is assisting people of different cultures to maintain care values that help them to maintain or restore health. So does anybody have any specific cultural practices that they use for health? Do any of you have any specific cultural practices that you use to maintain health? No? You just wake up and just go about your day. I mean, this could be like cupping, um, you know, even, looking at, giving blood or other things. So there's, and there's a lot of, we know that there's a lot of cultures out there that may have specific cultural, what's the word I'm looking, practices that they use, right, that we can incorporate into their healthcare. And so, that's the importance of providing that holistic care and making sure that we're doing an accurate cultural assessment on our patients. Cultural care accommodation or negotiation, right? Again, these are what, are we, can we incorporate some of their cultural requests into their plan of care? As long as it's not particularly dangerous, it's not going to harm them, or in a hospital setting, if it's not going to interrupt the care of others that are on the unit, we can tend to incorporate some of their cultural preferences in their care. Cultural care repatterning or restructuring. Again, her theory is concerned with respecting cultural differences. But again, we still have to provide that safe, right, protective environment. And so how can we incorporate their cultural practices while still maintaining a safe and protective environment, right? So these are some things that we have to take into consideration when we're providing care. As long as it's safe and it's not going to interrupt the care or disturb other clients, right? We can generally incorporate that cultural care. Oops. We have Hildegard Peplau. She developed the interpersonal relations theory. And this is a basis for developing a therapeutic relationship with a client. This was designed mostly with our psychiatric patients. But the relationship that is developed has parameters and is a major part of the treatment. So she described 4 overlapping phases: orientation, identification, exploitation, and resolution. So during the orientation phase of Peplau's theory, the client seeks assistance because of a need, right? So whatever that need is, the client has now, sought assistance. A problem's been identified, and then the nurse works with the client to help them recognize the problem. And, usually we'll have some personal and social growth that occurs during that initial step during orientation. Identification: during this phase, the client understands the situation and responds to the nurse who is supplying their help. During the exploitation phase, the client begins to depend on the nurse and uses the help that is offered. And at this point, we are exploring all possibilities. During the resolution phase, okay, This is where the dependent behavior must now be given up as the therapeutic relationship comes to an end. And so as we're ending our therapeutic relationship, it's really important, and the nurse needs to handle this appropriately, because if there's any kind of faulty resolution at the end, right, then, there could be some big physical symptoms that occur. And during our therapeutic relationships with our clients, right, we have a lot of different roles that we play. We're a resource person, we're teachers, we're leaders, we're advocates, we're counselors, right? So there's a lot of different roles that we play when we're working with our clients, depending on the context of the relationship. Rosenstock, he developed the health belief, he developed the health belief theory, that tries to explain why or why not a person will take action to prevent or detect illness. All right. So according to his theories, perceptions vary and may have no basis in reality. Beliefs are connected to existing boundaries. So they may see preventative or treatment activities as expensive, painful, inconvenient. And then acute action is seen as necessary. So whether it's they, all of a sudden have pain, they saw a news story, they got a reminder call from a healthcare provider, so they have to have a cue. So just in your experience, what are some perception, like why would some people not want to take action to prevent or detect illness? In your educational experience and the things that you've learned so far in nursing school, what are some reasons that people don't take action to prevent or detect illness?
Their religion.
Religion. Okay, what else?
They
What-
might not want to find out how bad off they are,
Okay, they're afraid to find out how bad off they are. Okay. What else may be a big one?
They
Like a
might not
huge
have
one.
insurance and they might not be able to pay for it.
They may not have insurance and they may not be able to pay for it, right? So that's a huge issue. We also have to look at health literacy, right? What do they know about, maintaining their health? So, there's many different reasons why people, choose not to take action to prevent or detect illness. And whoever's, I can't remember, I apologize. But fear is a big one, right? If you ignore it, it'll go away, right? Or, they may not want to find out what's wrong with them. So yeah, so good job. Awesome. And so we can use this theory, right? When we're using the nursing process to promote health, right? Like your yearly exams, your vaccines. It also can be helpful when we're developing interventions and outcomes, when we're, dealing with a disease process or an identified health issue. Then we have Sister Callista Roy. She developed the adaptation model, which is a holistic adaptive system. And so according to her, there are both internal and external stimuli that affect the symptoms. And so she identified the types of stimuli as focal, which is something direct, such as, the client is experiencing pain. Contextual, meaning other factors that affect the focal stimuli, such as being examined in the area of pain. And then residual is both internal and external factors that may not always be evident, like a memory of previous pain and the effect that it had on the client. And then coping mechanisms are identified as either regulatory or regulator or cognitor. Regulator subsystem is the internal effects that take place in response to what is happening internally. And so this could be nerves, this could be chemical processes, it could be your endocrine process. This is, the body that is automatically trying to regulate the system that's being affected, right? Think of your, what are those? Oh, can't think of the word all of a sudden. It just went out of my head. Your body's adaptive mechanisms. Your cognitive subsystem, this is the learning, the processing, the judging, and the emotion that people use to cope with what has happened. And so her theory is actually really interesting. And trust me, as you go into your RN, your BSNs, you'll get a lot deeper into your nursing theorists. Then we have Gene Watson. And so Gene Watson's theory of human caring of human care is probably one of the most well-known. But according to her theory, health is harmony between the body, mind, and spirit. It involves self-perception and how the self is experienced. Illness is a lack of harmony within the self and the soul. And so the nursing role is a caring process to help the client regain harmony and health, right? So through this caring process, the client develops self-knowledge as well as self-healing. And that allows the client to solve problems and to grow. And not just the client, but the nurse will grow it through this process as well. So these are just a few of the theorists. I know that when you did your what paper was that? Oh my gosh, my brain just like forgot what it was. Your professional development paper, right? You went to nursing theories. And so you use Benner's model, right, to write your paper. And so if you go to nursing theorists, if you have an interest in nursing theory, you can see that there's like, a ton of other theorists that are out there. And this is just like the tip of the iceberg. All of the theories out there, a lot of them focus on nursing, a lot of them, kind of focus on education. And so there's a variety of theories out there for every part of nursing. Gene Watson and I want to say actually Dorothea Orem was my favorite theorist. And when I wrote a lot of my care plans and a lot of my other stuff when I was in nursing school, I wrote it using Dorothea Orem's self-care deficit and Gene Watson's theory of human care, just because those were kind of my favorites. So, and we get into nursing research. So research in any profession supports existing knowledge. It develops new knowledge based on observation and experimentation, right? So this goes all the way back to wonderful Florence Nightingale, right? As she collected her data about the soldiers' morbidity and mortality in during the Crimean War. And really kind of set the basis on that evidence-based practice for nurses to follow. And so nursing research has improved existing nursing knowledge. It also has generated new knowledge. And so why is it so important, right? It helps to identify specific nursing interventions that are proven effective, not merely based on tradition, right? So, this is the way we always did it. Well, why do we do it this way, right? What's the basis for the reasoning on why we do it? That is the research that we have done. It also provides evidence that supports the quality and cost effectiveness of what nurses do. And it also generates knowledge for clinical practice, nursing education, and delivery of nursing services. So again, why is it we do what we do? Why is a Foley catheter insertion a sterile procedure? Why is trach suctioning sterile, but trach care is not sterile, right? So why is it that we do what we do? And that's, based off of nursing research. Raise your hand if you like doing research. Nobody likes to do research. Everybody's just looking at me like, yeah, no, we're good without the research. It can be very tedious. Nurse research, any type of research, whether it's nursing research, whether it's research for anything, right? It can be a very tedious process. And you have to like to do it. See, for me, I love doing research. I will research stuff all day long. You know what I don't like to do is write papers. I can research. Give me a topic and you want information about it, I will provide you with the information. Just don't make me write a paper about it. So that's, I love to, learn and read new things, but yeah, writing those papers. But nurses, at all levels are encouraged to participate and promote nursing research. And we do this in a variety of different ways. So we have different types of studies. The two main types of research studies that we do in nursing are quantitative and qualitative studies. All right. So quantitative research studies are objective studies. A variable is the event the researcher is trying to measure. And we have two types of variables. One variable is the group receiving the intervention, and the other variable is the group that does not receive the intervention. So what does that mean? So let's think back all the way to pharmacology. Okay. And I know that was a really long time ago. So when we think about when we do new drug studies, right? How do we test new drugs on to see if they're effective, right? We have two groups of people, right? We have a group of people that we're giving the new drug to, and we have a group of people that maybe are receiving a placebo, right? A placebo study, right? So one group is receiving the intervention, the other group is not receiving the intervention. All right. And then we take numerical data that's collected, it's measured, and we use statistics to describe the variables, the relationship among the variables and we're just looking at cause and effect. So both groups think that they're getting the intervention, right? And what are the outcomes? What is the one group experiencing? What is the other group experience? And we are just looking at that relationship. Randomized control trial is the recommended type of a quantitative study. And so again, one group receives a medication, the other receives maybe either a current med or a placebo. And so we are going to then look to compare those two groups. A qualitative study is a subjective study. All right, with the qualitative study, we're gathering data by interviews and direct observation. So, take a group of nursing students and say, I'm going to interview everybody about what was your experience like in nursing school. Is everybody's experience going to be the same for nursing school? No, right? Some people may find nursing school easy and they breeze right through. Others struggle a little bit more, right? Some students may have had lots of, personal issues and, things that went on while they were in nursing school. Others may not, right? So everybody's experience is different. All right. So we're looking at the lived experience of either individuals or groups. So you can have, what a variety. Phenomenology is also a type of the qualitative study. Others are things like grounded theory studies. And so, they all contribute to nursing, and they have assisted in establishing nursing as an independent science. So phenomenology is an occurrence or circumstance that a researcher studies. So a case study examining the lived experiences of high school students who are both gifted and diagnosed with ADHD, right? So very specific, right? But it's more of a subjective data. Evidence-based practice. So Dr. Archie Cochrane, or Cochrane, sorry, he was a British epidemiologist. He challenged the public to pay only for medical care that was proven to be effective. And he advocated for the use of randomized control trials as a means of reliably informing healthcare practice. So the Cochrane collaboration was established to prepare and promote accessibility of Cochrane Reviews, which is a collection of evidence-based healthcare interventions that was collected using a systematic review of research. We have, in 1999, the Institute of Medicine issued the report To Err is Human, which, what is it? To Err is Human, Building a Safer Healthcare System, which discussed the incidence of medical errors in healthcare and the need for reform. And so I don't know if anybody has ever heard of this before, but this was a pretty significant study that was collected in 1999, and it showed a pretty staggering amount of people that were injured or died as a result of medical, what's the word I'm looking for? Giving the wrong medication, wrong site surgeries, things like that. It's a pretty interesting study. They did a follow-up, and after the study was published, they did some reforms within healthcare, how we provide our medications, some of the safety practices for surgeries and things, but not even 20 years later, there wasn't a significant improvement in the amount of errors and deaths that were that still occurred. So this is really interesting. In 2001, the IOM issued Crossing the Quality Chasm, which a new health system for the 21st century, calling for consistent high quality healthcare for all people. Included was patients should receive care based on the best available scientific knowledge. So again, this just shows how important current research is. During the last few years, insurance companies began to pay for healthcare practices only if their effectiveness is supported by scientific evidence, right? So, if we're going to do a procedure or something, it needs to be supported. During the last decade, hospitals are denied payment when complications in a Medicare client develop if evidence-based guidelines are not followed. And so a lot of you have probably heard this, right? It's not about the quantity of care, it's about the quality of care, right? So if a client comes in and let's say we put a Foley catheter in, all right, and they develop a catheter-associated UTI, or they get a central line infection, or they develop a decubitus ulcer, okay, the Medicare is not going to they're not going to reimburse for that client's care for those issues because it was caused by that hospital. So a lot of you, when you go work in those hospitals, there's, very specific procedures, right, in place to try to prevent those from occurring. Client and families are seeking the latest evidence on websites, right, about the most effective treatment for illnesses and disease, right? What happens when we get sick? We right, go to Dr. Google, we start Googling symptoms, right? What can we do to, help ourselves? So there's a lot. There's also demonstration projects that are funded by the federal government, and other partners at, looking at identifying client outcomes that are grounded in evidence. And so evidence-based practice is going to be all out there. You have the NCSBN is a good website. NLN, the Institute of Medicine, Joint Commission, Joanna Briggs. There's another one. Why can't I think of it? Robert J. Woods is another. The Robert J. Woods Foundation is another one. So there's a variety of resources out there for you to look for evidence-based practice. And so when we look at how evidence is, or how best evidence for practice guidelines is determined, we formulate that practice question. Then we use our professional resources, right? The most relevant research evidence pertaining to what we're trying to answer. Then we get an expert or a panel of experts to conduct a systematic review of literature, which is basically we're going to read as many studies as possible and we're going to write a summary of the results. Guidelines are determined, right? And then we use critical thinking skills. The gathered evidence is combined with clinical practice or clinical experience and clients' preferences and values for use in a specific clinical situation. And so just the elements of evidence-based practice: best research evidence, your clinical expertise, and your client's preferences. Those are all the elements that we use when we look at evidence-based practice. So what is the nurse's role? So we look at this, and I'm going to stop sharing. So all levels of nurses should have some partake in nursing research. So there's nurses that have research doctorates. They're the ones that do the design and implement the research studies. They publish their findings. We also have nurses that have practice doctorates. They present research and formulate evidence-based, protocols. So your difference between your nurse PhD and your nurse DNP, right? At the master's level, we can formulate research questions and then evaluate the effectiveness of, solutions. At the bachelor's level, they also can identify questions. They can critique research. They can use evidence as solutions to nursing problems. At the associate degree level, they are the ones that are going to challenge that status quo, question assumptions, offer new insights. And then the practical and vocational nurses question the basis for nursing actions by considering research evidence, tradition, and client preference. So I will tell you this from experience as, working with clinical partners. If you are working in an organization, whether it's a hospital, whether it's a long-term care, and there's a procedure that just doesn't make sense, that there's an easier way that this procedure can be done, research it and bring that to your leadership. We promote scholarship. Okay. So if there's, if you think that it can be done a different way, or there's a better way to do something, as long as it is still practice standard, right? Bring that to you, we look for improvements in healthcare, using that evidence-based research. It is okay to raise questions and challenge tradition, seek creative approaches to problems. It is welcome, because that is how we develop as nurses. That is how we advance the nursing profession. right? So it's not, this is the way it's always been done. And I'm sure a lot of people have heard that, why do we do it this way? Well, because that's kind of how it's always been done, but that doesn't mean it has to stay that way, right? The goal here is to improve, right? And making sure that we are providing the best care for our patients. And like I said, I love to research. I love to read up on new things and how, what can I do better? You know, than just presenting it. Those nurse managers are looking for input. They're looking for you to be proactive. And I'm not saying you have to, right? I'm just saying that if you identify that there is something that can be changed, right, then start that process, but make sure that you have the evidence behind you, right, in order to start that process. All right. So with that being said, does anybody have any questions?
I have a question as far as practicing.
Okay.
I did bring it up before, but I'm not really sure if there is something that can be done. My question, well, it's more like a statement and a question. My statement is like, you guys do like prepare us for the exams. You give us the information like straight up what it is that we need to know, such as vocabulary, concepts, and etc. But the thing is, when the exam comes up, it asks us in a way that you did not prepare us for. Like it asks us in a way that we have to think outside of what the normal meaning or what the normal example that has been given. Like it kind of, I'll give you an example. It won't make sense, but it'll kind of let you understand what I'm saying. So like if the standard explanation for something like, okay, this is the color red. The color red is for roses, the color red is for carpets, the color red is for paint. But then when you get to the exam, it's like, how many ways can you say red in Spanish in Spain? So it's like, we weren't prepared for that. That's not the type of question that we expected. So my question is like, do you have any advice on any apps or any types of techniques or something like, I don't know, that we could be using that'll prepare us for these situations that'll trip us up?
So are you talking about quiz questions?
No, exam questions.
Exam questions.
Mhm.
Okay. So when it comes down and it comes time for you to take your NCLEX, okay, you're going to see a lot more of those next gen style questions.
Mhm.
And so utilizing Saunders has some next gen style questions. Are
Mhm.
you using Hearst?
Yes, we do. We still use Hearst. Yeah.
So Hearst has some next gen style questions as well. It's just learning the style of question and picking out the information that the question is asking.
Mhm.
So we present the information in lecture, myself and Dr. Tenza present the information. And yes, critical thinking is absolutely necessary. So being able to identify the concept that the question is asking in the context that the question is asking is what's going to help you to pick the correct answer. Um, and so Saunders, your Hearst, those are all excellent resources for practice questions. And the more questions that you do, the more comfortable that you are with answering the questions.
Would you say that the level of the next gen questions for Hearst and for Saunders are on the same level as the exam? Because a lot of times it's basically just the language, and sometimes it seems as if the exam questions are absolutely ridiculous, and it's obvious that it's just to confuse you so you can get it wrong.
Okay, so now okay, so we're going from quizzes to exams. Okay.
It's all about exams. The quizzes, they're pretty much straightforward. It's the exams that I'm talking about because the language changes when it's an exam.
Okay. So I'm trying to figure out the best way to answer your question that will help you. Most, like I said, most of the time it's identifying the concept as well as the concept that, or the concept as well as the context that in the question that can help you to understand. That's the biggest thing, is maybe we can do this on a sidebar, and go through some of the questions, because when reading the questions, and nursing questions are always going to be different than any other, whether, non-nursing. And so it's being able to pick out the concept as well as the context of the question. So we can probably meet on the side and do some test taking strategies that way.
Okay. Thank you.
You're welcome. Anybody else have any questions? All right, so again, we are on the downhill. So for week 7, I'm hoping everybody read the assignments or read the announcement. So for week 7, we had our lecture for today. We did our quiz 4. Remember, you have your NCSBM position paper that is due in week 8. This week you have just your discussion board that is due. So the initial response is due by Wednesday, and then your, peer responses are due no later than Sunday. And then just as an update, just as not an update, but just as a reminder, so week 8, we will do chapters 5, 15, and 16. You will also have quiz 5 next week, because we do not have class in week 9 for Labor Day. All right, so just keep that in mind, right? So we're going to do 3 chapters next week along with quiz 5. It is in your announcements. Then for your, week 10, we will have unit exam 3. The overview for unit exam 3, I will send that out. It is not finished yet. But it'll be the chapters that were covered last week, this week, and next week. Okay, so those are going to be the chapters for exam 3, and all of them off the top of my head. So I can go through and tell you, though, if you give me 1 second. All right, so week 7, we had chapter 18 this week was the chapter 18, chapter 17, or chapter 18 and chapter 13. So those 2, and then 3 chapters from next week will be for exam 3. Any other questions?
So 18 and 13 will be for quiz 5?
Correct.
Okay.
All right, no other questions? All right, well, you guys have a great week, and I will see you next week.